Lung channel, Han Tai Yin. There are 11 points. It originates in the middle jiao. There are 2 branches, split at lung 7. The collateral channel, back of the hand to Li channel on the index finger. Part of the primary, branch to the thenar eminence of the thumb. Li channel, hand Yang Ming. The Li channel crosses the midpoint of the body, ends on the opposite side from the start. Li4 is the command point of the face and mouth. It is a bilateral channel. Right Li4 to treat issues on the left side of the face. Left Li4 to treat issues on the right side of the face. There are 20 points on the Li channel, from the lateral index finger to the nasolabial groove at the side of the wing of the nose, the ala nasi. Stomach channel, foot Yang Ming. There are 45 points. It originates at Li20 at the nasolabial groove, lateral to the ala nasi. Stomach 8 does not connect to stomach 9, but to stomach 5. And the stomach channel goes to the upper gums. For numbness, pain, swelling in the upper gums, use points on legs for stomach. There are 3 branches. The lower anterior aspect of the midline on top of the foot terminates at stomach 45. Lateral aspect of second toenail, lower corner. Splits at stomach 36, goes down lateral aspect of the leg and terminates at the lateral aspect of the third toe. It splits at stomach 42. It goes obliquely across the foot to meet with spleen 1 at the medial aspect of the great toe. Spleen channel, foot Tai Yin. There are 21 points. The spleen channel begins at the medial corner of the nail of the big toe, runs along the medial aspect of the foot on the border where the skin changes color and texture. The lower leg follows the posterior border of the tibia on the medial aspect. Upper leg ascends along the anterior medial aspect of the thigh. On the trunk, it intersects with the ren, enters the spleen, and connects with the stomach. It runs 6 sun lateral and terminates on the lateral aspect of the ribs 6 sun below the axilla, midway between the axilla and the 11th floating rib. Spleen crosses the liver channel, 8 sun above the medial malleolus. Below this point, liver runs anterior. After this point, the liver runs posterior. The spleen channel goes to the root of the tongue, and the heart goes to the upper surface. Heart channel, Han Shao Yin. The heart channel has 9 points and ascends to the face and connects to the muji and upper surface of the root of the tongue. Muji is eye system or tissues connecting eye to the brain. Condition of the heart is expressed in the inner and outer canthus of the eyes. Other channels related to the eyes are liver and heart, but have yang aspects. Heart has fire and goes to the face, eyes, and tongue. The heart channel begins in the heart organ. There are 3 branches of the heart. 1 descends from the heart through the diaphragm to the SI organ. 2 from the heart ascends next to the esophagus to the face, cheek, and eye. 3 heart to lung to axilla, down the medial aspect of the arm, terminating at the radial corner of the nail on the pinky. The SI channel, Han Tai Yang. The SI channel has 19 points. The SI channel begins at the ulnar side of the little fingernail. The SI channel ascends along the ulnar or yang side of the arm to the medial side of the elbow, staying on the yang aspect, to the shoulder, then to do 14, over the shoulder to the anterior side of the body, up the neck to the cheek below the eye, around and into the ear. 1 branch descends to the lower Hasi point of stomach 39. The SI connects to the heart, stomach, and SI. The UB channel, foot Tai Yang. There are 67 points. UB3 through UB9 are on the scalp. The UB channel originates at UB1, the inner canthus of the eye. The organs associated with it are the UB and the kidney. 3 branches. 1 is transverse from UB1 to the Du channel at Du20. 2 oblique from UB1 to the temple and ear. 3 along the main channel to the occipital area at UB9 and 10. Branches from the occipital region oblique and down to meet with the other yang channels in the Du area. 2 branches from down the posterior to make up the inner and outer bladder lines. The first bladder line starts level with the spinous process of T1 and 1.5 soon lateral to the midline. Goes down the vertebra to UB30 level with S4, where it zigzags and goes over the openings of the sacral foramen, making up UB30 through UB34. UB35 is at the tip of the coccyx and 1/2 soon lateral. This line continues down the back of the thigh to the center of the popliteal crease where it meets the second UB line. The second bladder line starts at UB10, drops obliquely to the level of the tip of the spinous process of T2 and 3 soon lateral midline. UB points on this line are level with and associated with the first bladder line. UB41 through UB54 are on this line. After the level of S4, this line drops down the posterior aspect of the upper leg and meets the first bladder line at UB40. The bladder channel continues down the gastrocnemius and to the lateral aspect of the lower leg, terminating at UB67 on the lateral aspect of the little toe. The kidney channel, foot Xiao Yin. There are 27 points. The kidney channel enters all yin organs except the spleen, and only the yang organs it enters is the bladder. The kidney channel begins under the little toe and terminates at kidney 27, 2 soon lateral midline just below the clavicle. Abdominal points are 1/2 soon lateral to the midline. Chest points are 2 soon lateral to the midline. The kidney channel enters the cavity at the groin, enters the spine at the coccyx, exiting at L2, which is UB23 area, then to the kidney and UB, then exits from the bladder and the lower abdomen kidney points begin. From the kidney goes upward through the liver, diaphragm, heart, lung, PC, and through the throat to terminate at the root of the tongue. PC channel, Han Jue Yin. There are 9 points. The PC channel originates in the center of the chest from the pericardium organ, goes through the diaphragm to connect with the 3 jowls, upper jowl, middle jowl, lower jowl. 2 branches of the PC channel, from the chest area to 3 soon below the anterior end of the axillary fold, then curves upward to the fold and travels down the medial arm between the heart and lung channels, between the tendons of palmaris longus and flexor carpi radialis, to the tip of the middle finger. Splits from the main channel at the palm to the ring finger to connect with the sanjiao. The sanjiao channel, Han Shaoyang. There are 23 points. The sanjiao channel begins on the ulnar corner of the little finger, travels up the back of the hand and arm to the shoulder, to a point above the scapula on the back, and meets the other yang channels at Du14. Goes to the lateral side of the neck and to the face behind the ear. There's 3 branches. One enters the ear and emerges at the anterior ear, travels up the zygomatic arch to the outer canthus, meeting the GB channel. 2 goes to the apex of the ear, curving down the front side of the ear, cheek, and then finally the infraorbital ridge of the eye. 3, from the supraclavicular fossa, goes to the face on the lateral side of the neck and to the thoracic cavity to the heart and PC, entering the diaphragm and connecting to the other jowls. The gallbladder channel, foot Shaoyang. There are 44 points. The gallbladder channel begins at the outer canthus, GB1. The gallbladder channel pathway is from the outer canthus at GB1 to the front of the ear, curves to stomach 8, temporal, to the ear, to the temple. Gallbladder channel terminates at the lateral corner of the 4th toe, splits obliquely at gallbladder 41 to the medial aspect of the big toe to meet with the liver channel. The liver channel, foot Jue Yin. There are 14 points. The liver channel originates on the lateral side of the big toe, or the hairy portion on top of the big toe. All foot yin channels meet at spleen 6, 3 soon proximal to the medial malleolus. The liver channel begins at the lateral aspect of the big toe, opposing spleen 1, and runs anterior to the spleen channel until it reaches a point 8 soon proximal to the prominence of the medial malleolus. At this point, the liver channel runs posterior to the spleen channel. The liver crosses the midline of the body in 2 locations, 1. The liver encircles the genitals, crossing the midline, but returning to its original side, then enters the body deeply at the pubic region. 2. The liver encircles the interior aspect of the lips, crossing the midline. The ren, chong, and stomach also circle the lips. The liver and lung connect in the lungs. This is where the flow of qi begins, another circuit through the body. Liver and heart both connect to the muji, which is connective tissue between the brain, eye, and or the eye system. Liver and heart yin channels with yang-like features. Jue yin headaches are called vertex headaches due to the liver channel going to the vertex and is a Jue yin channel. Channel headaches. 1. Vertex headaches, Jue yin headaches, also known as migraine headaches. The top of the head, due 20, the PC and liver channels. Frontal headaches, or yang ming headaches, are affecting the stomach and LI channels, frontal area, or forehead. Temporal headaches, Shaoyang headaches, are the sanjiao and gallbladder channels. It's the temporal area, the side of the head. The occipital headaches are Taiyang headaches, occipital area or the back of the head. They are the SI and UB channels.